right, we're learning of another new problem, and this could be a biggie for the health care law that they're looking now to delay the so-called employer mandate that requires bosses to provide health care coverage for all of their workers. It was supposed to kick in on January 1, now delayed to at least the year 2015. So businesses, according to this, will not be penalized if they don't have their act together by then, certainly after then. But what are we to make of this concession on the part of the White House to probably recognize the obvious that this was just trouble to Jedediah and Julie and Lenwood. Lenwood, what do you think?
Well, it's a serious concession, Neil. I mean, you've seen what they've been doing the last few weeks. They've been going to the NFL, the NBA, and others trying to sell this idea of health care reform. And now, one of the most signature pieces of this law, the idea that employers with 50 employees or more would have to offer health care insurance or face a fine of $2,000. The fact that they're delaying this, because they say they need more time to transition. Neil, they've had since March of 2010 to plan for transition, so it shows there's serious flaws with the bill.
What do you think, Jedediah?
They have no faith in the law. I mean, the law is crumbling. We've seen from the start, between the lawsuits, between the mandate being a disaster. They obviously didn't take the time to really think about the key steps of this as they rolled it out. They pushed it through because they wanted it through. The silver lining is that they are, in some sense, responding to the business community. The business community is saying this is an enormous problem for us, and they were forced to respond. So that's my silver lining in this.
I do find that silver lining to be a good thing. Mm-hmm. You know, I don't think this junks this law, but I do think that maybe we reassess how we implement it. And that's good.
I think, this law is not going to be junked. Again, I hate to break it to you guys, but this law is going to be law. It's the law.
But you will admit that seems to be a very fractured law.
I think it's the kind of law that is a humongous undertaking, so therefore you're never going to have a smooth transition. Never.
But it would have been nice if they gave us a heads up about what a disaster it would be. Right?
If they had read it.
Are you kidding me? A heads up. You guys were warning what a disaster was going to be before Obama even discussed Obamacare.
But remember, they said we'd have to vote on it before we'd know it was in.
All right, so Nancy Pelosi says something stupid, but it doesn't mean that the law is bad. It's not.
So you think this is still a good thing and the time is a good thing?
Well, you guys actually should be thrilled because, as Jedediah said, responding to the business community and giving them more time to adjust to the law. So, you know, with this, you're kind of on the Republican side, you're damned if you do, you're damned if you don't. I think Republicans should be happy about this. Businesses should be happy about this. It's actually allowing people to transition to the law.
It's all they could do because it's so grossly unpopular with the majority of Americans that I think to ignore what the business community was saying at this point would be a lose-lose for them. They had to at least make an effort to say,
I think it's bigger than that, Jedediah. And to Julie's point here, and I can see there, you know, on paper it did sound good at launch. But even we were saying in the coverage of this, Lenwood, that you can't promise the sky and expect people not to pay more for it. You can't cover people with pre-existing conditions and bring it on your kids so that they can live with you until they're 85 years old or whatever. Which, by the way, will be my case, but that's okay. I love her dearly. But I'm just saying that you can't promise all of that and not expect premiums to go up. They did go up. And now the reality of all of this, companies that will always think of the bottom line will get around this by finding ways to get rid of their full-time workers and make them part-time workers so they don't have to cover them. Surely they could have seen the fallout from this, and now they seem to be acknowledging this.
Neil, I mean, when Washington passes laws, so often they forget that people respond. And a lot of the criticisms of this particular part of the bill was that large employers simply couldn't afford it, so they were moving employees to part-time status. So I'm not so sure a one-year freeze here is really going to do much. I think there's a fatal flaw in this legislation.
Well, what are you saying? What's going to happen?
Well, you know, they can only off for so long. I think at some point, if they can't get this marketplace to work and where the reporting requirements can easily be done, I think they're going to have to go back and look at it.
Well, go back and look at it or go back and junk it. Julie, what do they have to junk it?
They're not junking this law. I mean, you could dream on, my friends. It's going to happen. It's the law. We had an election.
But you don't even know what it is, what they're going to have.
Of course I know what it is.
No, you don't.
Yes, I do.
They don't even know. The businesses don't know. No two doctors know.
Well, no two doctors can agree on anything. So, you know, right there and then you've got a problem. But, look, of course I know because we've been talking about this and beating this dead horse since 2010.
Well, we've been beating the dead economic horse since this first came into fruition about how the numbers don't don't add up, and that
Yes,
this
some of us weren't.
the reality doesn't add up. Now, I guess we have to realize, all right, it's billions short, needs more money, needs to be marketed. They don't know what they're marketing. I think they've got a tough sell.
It's
here.
called the Affordable Care Act, and the costs of premiums are going up. I mean, you can't tell me that when you crafted the law that you didn't factor that into
Well,
the equation.
is this
My
thing going to
fear-
be gone?
my
What is
fear-
your sense?
No. I think it's going to stay. But my fear is that they're going to start pushing. Well, see, I told you we should have gone with single payer. That was the
But
way
see,
to go.
there's my point. Lynn, I think,
That's
and
what
this
I would
to
say, by the
Julie's
way.
point, and I think this was the goal all along, and why United Healthcare and all of these others have left California. They're more or less setting up the stage for a single payer plan.
Let's be clear that
I sure hope that's
let's be
not the case.
clear that United Healthcare left the individual ratepayer market, which is a tiny
But it's
percentage
part of
their business
California,
in
and part of it are the state requirements there for the national health care
They're
law.
still-
But having said, they're still there. You're right.
still there.
But I'm saying
Big time.
that was the goal, Linwood. That I think that the administration is trying to push these guys out to mean that it's a single payer, and that single payer is the United States government.
Well, I'm not sure. I can't speak to that. I can say that this has got to be a tremendous embarrassment to them. This is their signature law. Their signature piece of their signature law is being delayed for a year. It's not good. I certainly hope they don't
Julie,
think the
you should
answer is
feel
more
horrible about
government.
it.
You know
should
what?
feel absolutely
I
horrible.
feel
This is
great
all your
about?
fault.
No, you know what I feel great about? I feel great about the fact that today, to this law, that if I get cancer, nobody's going to throw me off off my insurance. Means that if I had cancer before, I could get insurance, and nobody's not going to reject me. I can actually feel good
So
about the
that's
fact that your
worth
daughter.
all of the above.
My God, of course, it'll save people's lives. Is that not worth it to you?
But
The quality of care is going to go down.
The quality
with
of
the
Obamacare.
only
It's not
care is
going
now.
to
We shall
save
see.
people.
The care is a big debate. We'll debate it tomorrow. See you then.